some of the common questions that we're getting about Zika virus include how is it transmitted? So it is transmitted by a certain type of mosquito. This mosquito is in the United States, although they are not infected at this point in time, the mosquito populations in the US. But this is something that we're closely following. It can be transmitted from a mosquito to a person, and then that person, if they get bitten by an uninfected mosquito, can then infect a new mosquito. So it's very important in terms of making sure for prevention that we are protecting ourselves against mosquitoes. So using appropriate skin repellents when we're going outdoors, making sure that we're eliminating places near our homes where mosquitoes may be present, those kinds of things. Another question is it associated with birth defects? The association between Zika virus and microcephaly is still evolving, but more and more data is emerging that there probably is a close connection between the two. There was recently a publication in the New England Journal of Medicine that did look at the causality, and more and more reports are surfacing that there is probably a link. Also, another question is there a link between Zika virus and Guillain-Barré syndrome? And that also still has to be further investigated to determine if that does put you at an increased risk of Guillain-Barré. Some other common questions are what are the common symptoms? These would be rash, conjunctivitis or red eyes, also pain in the eyes, and then joint pain. Those are sort of the more characteristic symptoms that patients would experience. Most of the time, it is self-limited, and most patients will have resolution of all their signs and symptoms and be okay. There are only about 1 in 5 cases where patients actually do develop symptoms. So about 80% of the time, people can be infected but have no symptoms.